Now, when it comes to sarcoidosis patients do have a higher, there are sleep-related disorders associated with sarcoidosis. There's actually a higher prevalence of obstructive sleep apnea with sarcoidosis patients. And those sarcoidosis patients that have obstructive sleep apnea and also have the sarcoid that involves their lung parenchyma have higher states of apnea or hypoapnea and oxygen desaturation. Sarcoidosis patients can also experience periodic limb movements and restless leg when they sleep. And sarcoidosis in itself is an independent predictor of excessive daytime sleepiness. So patients who have this, by no fault of their own, can experience excessive daytime sleepiness, which is why it's so important to make sure we have our sleep routine dialed in. And I will get to that definitely, because it's almost like having a sleep prescription. What's the best way to sleep? But what is really happening when sarcoidosis patients experience sleep disorders? Well, respiratory symptoms are associated with pulmonary sarcoidosis, as you know, the most common clinical disease manifestation. Those granulomas can lead to sleep disturbances by causing inflammation in the airways where we breathe. That's why here at the Life and Breath Foundation, we're always emphasizing practicing your breath. It's not just the breath of the day and how you're breathing normally, but really getting into a good state of breathing and having ways to open up the airways. Now, also, what happens is a number of sarcoidosis patients are on corticosteroids because that's the mainstay of treatment. So weight gain from the corticosteroids may actually induce this obstructive sleep apnea. So something to keep in mind. And then also we can have patients that have neurosarcoidosis. And in neurosarcoidosis, you can actually have a direct infiltration of these granulomas into this specific part of the brain, which is called the hypothalamus, that is involved in regulating that sleep and circadian function. Which for neurosarcoidosis patients, sleep is really quite a struggle because now it's in a place where that organ doesn't even have its full ability. So when we were looking at sleep disturbances and symptom burden in sarcoidosis patients. So the study that I came across was a study done out at the University of California, San Francisco. And what their hypothesis was that sarcoidosis patients would report more sleep disturbances than healthy controls. And they wanted to see, what was going on here? What were the actual symptoms? Was there any relationship with the type of sarcoid, the extent of sarcoid? What were we exactly seeing? So in this study, they took 84 sarcoidosis patients and 30 healthy controls. And they measured sleep disturbance, psychosocial symptoms, and quality of life, both at the enrollment of the study and longitudinally over time. And one of the ways they did this was using a general sleep disturbance scale with a questionnaire, seeing where the individuals were answering questions between having no disturbance, rare disturbance, occasional, and then frequent disturbance. So in this study, the University of California found that 54% of sarcoidosis patients reported frequent and occasional sleep disturbance compared to only 17% of the healthy controls. And those sleep disturbances most strongly correlated with other things such as fatigue, depression, cognitive dysfunction, and negatively impacted the quality of life. Now, if you think of what the function of sleep is, this makes sense for anybody who's not sleeping. You would be fatigued. You would be, mentally not at your optimal state. Now, the question is, okay, I have sarcoid, my sarcoid's not that bad versus somebody who has, a very active form of sarcoid. How do these individuals compare? And what they found was that the traditional measures of sarcoidosis disease severity or activity was not associated with sleep disturbances. So what that means is that there was no difference with sarcoid severity or clinical disease activity, that somebody who has a worse sarcoidosis would have worse sleep disturbances. There was no difference there. There was also no difference in the sleep disturbance score for how old the patient was, the sex of the patient, whether the patient had a higher body mass index, whether the patient snored, or if the patient had blood pressure differences. And then also there was no difference noted when it came to if a sarcoid patient was using immunosuppression with prednisone, or if they were using sleep aid medication. So what this study actually brings to light to me is that yes, sarcoidosis is a contributing factor, but really having that sleep ritual, that sleep hygiene is going to be so important for the individual. No matter what stage of sarcoid you are in, you are going to have benefit from this, as opposed to just kind of throwing your hands up in the air and kind of giving up that I have sarcoid, I'm immunosuppressed, this is what's going to happen. You actually do have quite a bit of control over this. So I do want you